Hi, I'm Wendy from Dr. Harvey Levy and Associates office. Today, we're talking about something very important, emergency dental care. You might think that dental emergencies only happens if you're bleeding heavily or lose a tooth, but that's not always the case. Any unplanned or urgent dental needs can be considered a dental emergency.
Let's dive into what constitutes a dental emergency and when you should see the dentist immediately. You may have a dental emergency if you experience pain or swelling in the mouth. If you lose a tooth or have a loose tooth due to physical trauma, if you are bleeding a lot from your mouth, and if you lost a crown or a filling.
Pain in the mouth that doesn't go away is a dental emergency. That is not normal. It should be checked out.
Typically, dental pain will only get worse the longer you wait. When you call to make an appointment, communicate. First, where is the pain? The tooth, gum, cheek, tongue? Second, what kind of pain is it? Piercing, throbbing, sensitive to hot or cold? And third, for how long have you been feeling the pain?
Swelling in your mouth is not normal. Swelling may have a known cause, such as biting your tongue, and it goes away by itself. When it doesn't, it could be an indication of infection or something worse.
When you call to make an appointment, you'll want to discuss the following. Where is the swelling? Around the tooth, around the gums, or on the tongue, inside the cheek? Is it in the face or on the neck? What kind of swelling is it? A pimple-like bump or puffiness? Is there drainage or an abnormal taste in your mouth? When did the swelling start? And has it gotten worse? If you experience pain or swelling as described, call your dentist and schedule an appointment. You could have an infection in your mouth that could spread to other areas of your body. While waiting for an appointment, try applying a cold compress, rinsing with salt water or saline solution, or using an over-the-counter pain medication to alleviate discomfort.
Let's talk about physical trauma to your face or mouth. That is a definite dental emergency.
If you or a loved one has lost a tooth or has a tooth that is loose due to potential trauma, acting quickly could save the tooth. If you lose the tooth, call your dentist immediately or go to an urgent care facility. If your tooth is knocked out and you are able to recover it, gently handle it by touching the crown, the whiter part of the tooth that you usually see, without touching the root. If the tooth is dirty, gently and briefly rinse it with water while holding the crown. If able, put the tooth back into the gum immediately, making sure that the tooth is oriented properly and not backwards. If you are not able to reimplant the tooth, place it in a clean container and cover the tooth with one of the following: pasteurized milk, egg whites, saline solution, or saliva from the person who's lost the tooth if you're out in the field. Saliva is only meant to be used as a last resort for less than an hour. The tooth should be transferred to one of the other recommended solutions as soon as possible. The tooth has the best chance of success if it is reimplanted within 1 hour.
When we're talking about bleeding from the mouth being a possible dental emergency, we're not talking about a little bit of blood when you're brushing and flossing. If your gums won't stop bleeding, especially after having an extraction, you should seek emergency dental care.
It is not normal to experience bleeding from the mouth without any obvious cause. Call your dentist immediately and communicate the following. Is the bleeding from a tooth that was pulled or other recent dental work? Where is the bleeding? Around a tooth or in the gums, on the tongue, or cheeks? When did the bleeding start? Has it gotten worse?
Losing a crown or a filling can be a dental emergency. When a filling or a crown breaks or falls out, your remaining tooth is more likely to break or chip. It could fracture. You may also have exposed nerves, which could be damaged or become infected. It's best to schedule an appointment as soon as possible to protect the tooth from further damage.
In the case that a crown has fallen out and is not broken, you can try to reinsert it by using a thin layer of denture adhesive or toothpaste until you can see the dentist. Please do not use any type of permanent glue. Practice placing the crown in the proper orientation before applying any temporary adhesive. If a filling has fallen out, don't try to put it back into the tooth. Just call the dentist so that the filled cavity doesn't get larger or the tooth breaks.
If you think that you're experiencing any dental emergency, call your dentist as soon as possible. Remember, it's always better to be safe than sorry when it comes to your dental health. Stay healthy and keep smiling.